Each year, we set membership fees to support the financial sustainability of CMPA, while striving to keep fees as low as possible. Membership fees vary across our 4 fee regions due to regional differences in medico-legal costs, the number of physicians, frequency of cases, and the risk levels of different specialties. Membership fees are collected to pay the estimated medico-legal costs of any given year, including compensation to patients and the cost to support our members for up to 4 decades. We're committed to managing our members' fees with care and foresight. Our aim is to keep membership fees relatively stable over the long term, even as investment markets and medical legal costs fluctuate. Depending on our financial position, we use fee debits and credits. And in the last 4 years alone, we've returned close to $770 million to our members in fee credits, largely due to the positive performance of our investment portfolio. This means the returns from our investment portfolio have paid a large portion of our members' cost of protection, rather than our members themselves. While membership fees are paid entirely by members, all provincial and territorial governments and their medical associations or federations have negotiated reimbursement agreements that are intended to offset some of the cost of liability protection. CMPA is not party to these negotiations. In 2024, our investments performed better than expected, which is a positive story for both our financial position and 2026 membership fees. Overall, the 2026 average membership fees, which I'm about to show you, are similar to those in 2025, with small changes in some fee regions due to increasing medical legal costs. As mentioned, CMPA has 4 unique fee regions due to the regional cost differences across the country, allowing for an equitable allocation of costs. The 4 regions are British Columbia and Alberta, Ontario, Québec, and Saskatchewan, Manitoba, Atlantic provinces, and the territories. Each region is independent, and there is no subsidization between the regions. For example, if one region is in a positive or negative financial position, this does not impact the other regions. The amount to be collected in each region is called the total cost per region. The average fee per member is the total cost per region divided by the number of members in that region. It is an average used for illustrative purposes and not an actual membership fee. When determining membership fees, we first calculate the total cost for the region and use this as the foundation to determine regional fees based on specialty or type of work. I will now share the 2026 average fee requirements, starting with British Columbia and Alberta. The medical legal costs in this region are trending upwards, meaning the total regional fee requirement is increasing by $12 million to $167 million. Therefore, the average fee requirement per member will increase slightly by 5% in 2026, or about $250 per member on average. Part of this fee increase can be attributed to increases in medical legal costs over the past 5 years that were slightly higher than we predicted. The cost of providing medical liability protection in Ontario is greater than in any other region, which is reflected in the membership fee. Due to a strong financial position in Ontario, the total regional fee requirement in 2026 will decrease by $28 million to $308 million. This means the average fee requirement per member decreases by 10% to $6,558. Turning now to the Québec fee region, which is in a strong financial position. In 2026, members in Quebec will see no increase in their fees. The total regional fee requirement remains at $10 million, and the average fee requirement per member remains the same at $448. The fees in the Saskatchewan, Manitoba, Atlantic and Territories region will increase in 2026 to ensure alignment with projected medico-legal costs. In 2026, the total regional fee requirement will increase by $5 million to $26 million. This means the average fee requirement per member will increase by 20% to $1,704, or an average increase of $284 per member. When compared to the fee requirements in 2021 and 2022, they are still considerably lower. Here is an overview of recent average fee requirements per member by region. As you can see, even though fees have increased in the Saskatchewan, Manitoba, Atlantic and Territories region, and the British Columbia and Alberta region, fees in all regions are still below 2020 average fees. Having shared the average fees per member, here's an example of actual membership fees for family physicians in Type of Work Code 35. The full listing of 2026 membership fees is now available on our website. You will be notified by email in the fall when the annual invoices are available on our website via the secure CMPA member portal. Our strong financial position should assure members that we will continue to be there for you and compensate patients proven to have been harmed by negligent care on your behalf, today, tomorrow, and well into the future. Thank you.